Hello there. My name is Jesus Guzman, and today I'll be informing you about depression, a topic many of you may know about. However, you probably don't know how much it may affect the human mind.
There are many people who have depression. It may be noticeable on some people, but for others, it's very hard to tell because they are good at hiding it from everyone else. There are many types of depressions: anxious distress, which is nonstop worrying about everything; mixed features, which is a high amount of self esteem, talking too much, and increased energy; melancholic features, which is laziness; atypical features, which is a depression that has temporary happiness by eating or sleeping more and sensitive to rejection; psychotic features, which is delusions and hallucinations; catalonia, which is a depression that includes motor activity; peripartum onset, which depression that happens during or after pregnancy; and seasonal pattern, which is depression during different seasons. The objective and subjective manifestations: a person with depression may feel sad, lonely, frustrated, angry, empty, tired, having anxiety, insomnia, or feeling guilty. For example, a teenager is depressed because he didn't know what to do after he graduates. He felt frustrated and lost because he didn't have a plan for his future. He felt lonely because he pushed away others who actually cared about him. And he felt guilty because all he does is blame himself for everything that he could have done, but doesn't take action and find that perfect future for him. Some of the signs and symptoms this person may have will be feeling sad, hopeless, sensitive, have angry outbursts or be frustrated all the time, lose interest in daily activities, especially activities they enjoy doing, lack energy, always tired, losing or gaining weight, speak, think, or move slowly, or having thoughts about suicide or abuse the usage of drugs and or alcohol. Since depression cannot be determined through X-ray, a radiologic tech may not have to worry about assessing the patient, but to take consideration of the patient, one must be careful with what they say or do because they can trigger the patient's emotions in any given second. For diagnosis, physical exams, lab tests, psychiatric evaluation, and MRI is used. MRI is used in order to get results of the brain activity by performing a structural MRI, which is used in order to discover the different parts of the brain that is being affected. For example, here on the left side, this person does not have depression, and it shows lots of neural activity. On the right side, this person does have depression and has less neural activity in the brain. Treatments and prognosis. Medications such as antidepressants or inhibitors are prescribed to the patients. Psychotherapy is another form of treatment because in order for the patient to get better, they must seek professional help. However, if the patient gets medication or stops using the medication, there are some risks, such as depression gets worse. If the female is pregnant or breastfeeding, it can lead to risk of the child, and suicidal thoughts will rise. Now, I am going to show you a video of Julia and her experience with depression.
My name is Julia and I'm 19 years old. In 2017, was diagnosed with major depressive disorder. I almost lost this battle. I didn't think it was gonna get better, but it did. I've had anxiety since I was a little kid. I always had this feeling that something terrible was gonna happen, and that presented itself in tightness in my chest. I'd get really shaky. I would have a lot of stomach pain. Those were the physical ways that it came out. For the longest time, I didn't know that was my anxiety. I just knew that was something that happened to me. Around middle school, I started to get depressed, and it progressively got worse as I got into high school. Everything just seemed kind of gray. And a lot of worthlessness too. I don't have anything to offer. From the outside, I think I hid it pretty well. I was a straight-A student. I hung out with my friends. I babysat all the time. I was involved in my church youth group. I didn't let people see that there was something going on. That was what stayed closed behind my bedroom door. Things started to feel more heavy. I started to self-harm as a way to cope. I started having suicidal ideation. I told my mom, I don't think I can keep myself safe. And I know my parents were shocked when they knew how bad it actually was. It was on a Sunday night. My mom called Children's, their hotline. I was evaluated by a social worker. And I think it was honestly the first time I was completely open about what was happening. And I told my social worker that I didn't necessarily want to die. And I knew that I needed a break from what was happening, from all the things I was feeling. And death seemed like the only option. And I just remember crying to her and being like, I don't know what else to do. Like, I'm stuck. Here I was completely broken. I could barely see the point in staying alive. I felt so ashamed of myself. And these people, they just treated me like a person. I felt validated and I had some hope. And I knew that okay, when I ask for help, help is given and it works. And I knew that this break I was looking for could be found in a hospital room instead of dying. Today, I am in remission from my depression for the first time in who knows how long. I'm getting to know parts of me that aren't just anxious and depressed Julia. I'm clean from self-harm. I'm majoring in social work, and I really want to work in behavioral health with children, specifically in a crisis or inpatient setting. I've started to become really passionate about advocating once I made it to the other side, because I almost didn't make it. You're not at fault for where you are right now. It's okay to be afraid, but I don't want you to give up. Because the thing about depression is it lies. You gotta fight to be here, because it does get better. And all of these lies will eventually go away. You just have to hold on, because it doesn't get to win. It doesn't get to take you. Because you're stronger than that, and you're worth more than that. And it's possible.
Here are the references I use for my project. In conclusion, depression is an illness many of us cannot overtake on our own. It can harm us physically and mentally. However, by seeking help, you can get better. Sometimes it's hard to express those thoughts and feelings to others, but at the end, your life matters. Thank you for watching.